agitated, worried, and impatient when they are ready to start a family and they're not getting pregnant. Of course, it can be frustrating and overwhelming, especially if they've tried conventional methods to maximize their chances, such as having frequent intercourse during their fertile windows and using tools like ovulation tracker apps and predictor kits. In fact, some women may even take a further steps, trying both conventional and alternative medicine to conceive, yet they couldn't get pregnant. This is when they start to wonder, is this a medical or spiritual problem? They begin to ask themselves question upon question. Do I simply need to be more patient? Without knowing that there are many reasons why a woman cannot get pregnant. And they have no idea of these factors that can be a barrier to their fertilities. So our topic today is infertility, and we are focusing on medical conditions affecting infertility. So if you are in this category, you will need to give me your ears. Perhaps you know anyone who is in this crisis. You will also need to share this show. So invite them right now. It may be one of these reasons I'm discussing today that caused the delay. I recommend you pay serious attention today like never before. So let's get started right after the break. I'm Dr. Betty. Thank you so much for joining us again today on Bofra Health and Nutrition Talk Show. Let's take a break.
Health is wealth, vital is vital. You gotta take care of yourself.
Hello, do you want to live your best? You want to live your way into a healthy and beautiful body, free from all forms of diseases such as diabetes, high blood pressure, cancer, hemorrhoid, and so on? Are you limited to particular food intake due to your health status? Oh yeah, I bring to you good news, as you can eat what you want. Yes, you can. B&B African Healthy Food provides foods that suit all forms of health status with long life. Contact us today for any of these services. Holistic nutrition consulting based on individual health status such as diabetes, high cholesterol, high blood pressure, among others. Visit us in our office at 10039 Bisonet Street, Suite 228D, Houston, Texas, with zip code 77036. You can as well book an appointment with us on our website www.begandbomservices.com or call 347-61 35485 347-61 35485. At B&B African Healthy Food, your health matters to us.
Health is wealth, vital is vital. You gotta take care of yourself.
All right, welcome back, viewers, and thank you so much for staying with us on the show today. This is Bofra Health and Nutrition Talk Show, your show, the show that brings to you information on preventive care all the time, every Sunday. God bless you for being on the show today. Our topic today focuses on medical conditions that affect infertility in both women and men. Yes, infertility is not only a woman problem. The problem may also be coming from man. This is a thing that we believe in Africa. We think that once a woman is facing this dilemma, is facing this crisis, the infertility, we believe that the problem only lies on women. No. The problem may be also coming from men. Yes, men may be the reasons of this infertility. Majority of people will become pregnant within the first 12 months of trying to conceive with regular unprotected intercourse, while some women will struggle for many years. Why is that? Because they are unlucky. Like I said before the break, there are many factors that can prevent a woman from getting pregnant. And I'm going to tell you all this factor today. But before I tell you this, I need you to know that we have a natural reason that can affect women from becoming pregnant. We also have a medical reasons for this problem as well. But today I'm going to be mentioning medical problems that affect infertility. They can delay a woman from getting pregnant, from conceiving. So let's talk about the medical conditions affecting fertility in both women and men. Now, before I mention these factors, let us first of all have understanding of what infertility is all about. What is infertility? We need to know what this problem is before we can talk about the causes. What is infertility? Infertility is the inability to become pregnant after 1 year of unprotected sex for women under 35 and 6 months for women 35 and older. Yes. So if you are within this age range, have you tried considering all the factors, both natural and medical reasons that can be any barrier to you getting pregnant? Have you considered all these factors? Because once we wait 1 month, 2 months, 3 months, getting to 6 months, we get worried for no reasons. We forget to think about the reason why. It could be little things. It could be the food you're eating. It could be the activities you're doing. It could be something wrong in your body, which is medical. We need to look at these factors first before we start getting worked up. Because let me tell you, when you are stressed out, it can also be a reason for not getting pregnant. Yes, I'm going to mention, I'll talk about it shortly. So infertility is the inability to become pregnant. Now, number one reason from the factors that can delay a woman from getting pregnant is fallopian tube obstruction. We're talking about medical reasons now, not natural one. Blocked or sacred fallopian tubes that prevent sperm from reaching the egg can be a frequent cause of infertility in women. And what can cause this blockage in a woman's fallopian tube? Pelvic infection, sexually transmitted disease, or endometriosis increases the risk for fallopian tube obstruction. So if you are having frequent pelvic infection or sexually transmitted disease, you have history of that, or you are having it frequently, this can cause fallopian tube obstruction. It can block your fallopian tube. Because a lot of women experience this medical problem, such as sexually transmitted disease, pelvic infection. We think this is nothing. Maybe when we were in school, in college, when we were young, we're in our adolescent age, we experience so many things. I'm not saying that this infection is caused by immorality. You can get infected through the toilet. You can get infected through the underwear you put on. It doesn't necessarily mean that pelvic infection is caused by sex. There are lots of pelvic or vagina or cervix problem that is caused by what we wear, the material we cover our feminine with, use of bathroom, use of toilet. This can be a vector for this infection. And as for the sexually transmitted disease, if we are not careful to know the kind of man we open our 2 legs for, we get ourselves into trouble. Our future is in danger because many people are facing this problem because they are unable to pay attention. They're unable to be so hygienic. They're unable to be so decent enough to know that this is not for me. Therefore, they experience so many pelvic infections, sexually transmitted diseases in the past. And now it's hurting them today. I've had so many ladies calling, asking for advice, food to eat, supplement to take, medication to use for infertility. And when you examine them, when you evaluate them, you ask questions verbally, they have to open up. If you don't open up, there's no way you can get help. I don't know what you have done in the past. If you don't tell me, there's no way I'm going to help you out. Your history, your past history will determine your treatment. I'm telling you this, you don't know. If you go to the doctor is going to ask a question which related to your past lifestyle. And if you are not talking, you're not getting the right help, So all this we've done in the past, and it's now hurting us. And instead of us to sit down and look back of the life we've lived in the past, so that we can get the right treatment, we're not doing that. We're not paying attention. We are just crying, oh, it is my mother-in-law, it is my stepmother, it is this, it is my friend, it is that. No! Sometimes we attach our problem to many things that have nothing to do with us. The problem we caused by ourselves, we tend to impose that on many people with no reasons. There is no reason for doing that. All you need to do is to sit down, look at your past history, look at the life you've lived in the past, then do the necessary thing. Once you discover the cause of your problem, this is what I've had in the past, so this could be the reason for my infertility, then take the further step and get rid of this problem on time before it is too late. Because there is time limit for every solution to our problems. Yes, if you don't know, I'm telling you today. Rather than waiting for somebody to give you solution without even knowing what the cause of the problem is, rather than waiting and crying and yelling and getting agitated, worried for no reason, attaching your problem to one another, you don't need to do that. You need to take the necessary step and do the right thing to ease yourself from this, from this tension. It's only in Africa we get worried for no reason. In fact, right now, if you cannot conceive by yourself, there are lots of ways you can get pregnant. There are lots of ways you can have a child without even stressing yourself and cause yourself another health problem, because when you stress too much, it can result into another thing, which is a very critical health problems, such as diabetes, high blood pressure, heart attack, cardiac arrest. You can have this as a result of you not giving yourself, a rest on the issue of infertility. We need to be very careful. Number 2 is irregular uterine shape. An irregularly shaped uterus can make it difficult for a fertilized egg to attach to the uterine wall. And this abnormality can be caused by uterine fibroids. Don't get agitated. Don't get nervous about this. Fibroid is not a cancer. That's what I mean. Fibroid is not a cancer. It's not cancerous. I have to let you know that, because many people have asked me so many questions about fibroids. They think fibroid is a cancer. It is not a cancer. Fibroids is non-cancerous growth on the uterine wall. Believe that. Stop getting worried about nothing. So, these abnormalities can be caused by uterine fibroids or scar tissue from surgery or infection. Maybe you have done, surgery in the past, or you have infection that have been taken care of in the past that can cause your uterine to bend or to be reshaped. It can result into irregular uterine shape, and that can cause your infertility. Number 3 is ovulation disorder. Sometimes women don't ovulate regularly and consistently. Yes, some have irregular period. Some don't even ovulate at all. Some women don't ovulate at all, and they don't know. Some women don't know they ovulate, because if you know that you are not ovulating, you don't have to wait to 3, 4, 5, 6 to a year before you realize you are not getting pregnant. Immediately you get married, after a month, you should notice something. You shouldn't wait till 1 year, because you are menstruating. And after your menstruation, your ovulation follows. Yes, few days after your menstruation, your ovulation follows. If you cannot realize, if you don't know that you ovulate, there is no way you can get pregnant. You get worried for no reason. Yes. Sporadic menstrual cycle can be caused by a condition known as hormonal imbalances, obesity, I told you, or polycystic ovary syndrome, PCOS. I've talked about PCOS on this show. It's a topic on its own. Check PCOS, the common cause of infertility in women, on YouTube channel, on our YouTube channel, Healthy Living with Bofa Show. You see it there. Listen to what I said there. Listen to all the messages in that particular video. Ovulation can also be impacted by excessive exercise. If you do too much exercise, yes, you can have delay in getting pregnant. Stress can also cause delay. I said it earlier. If you stress too much, maybe you walk and walk, no rest, or you do, exercise that is excessive, or low body weight, can also cause ovulation disorder. Yes. And once you have all this going on in your body, they can affect your fertility. They can cause infertility in you. This is where I'm going. Next is male factor. Like I said in the beginning, lots of people believe that once a woman experiences infertility, is delayed from getting pregnant, they think it's a woman thing. It is never a woman thing sometimes. And in more than 30% of infertility cases, there is a problem with sperm, such as low sperm count or abnormal sperm movement or shape. Yes, we are not paying attention to all these factors. We impose everything on women. Male factor, infertility can be due to a number of reasons, including trauma, medical conditions like diabetes, and unhealthy habits such as heavy drinking and smoking. Some men drink like crazy. They can drink their life out. Some smoke, and you will be smelling that smoke. You will smell that in their body, in their system, in their mouth, in their clothes, and you feel irritated. You feel like, oh my goodness. When you smoke or you drink, you affect your sperm. This thing affects your sperm. It can cause low sperm count or abnormal sperm movement. Yes, all this food you eat can be the reason why you have low sperm count, the reason why you have abnormal sperm, to our infertility, to how we look, to how we live, to how we breathe, to how we do so many things. Food counts. Food can be a very good factor in everything we do in this life. If you are not having good diet, if you eat on healthy food, if you live your life on healthy food, healthy diet, trust me, there's going to be a problem one way or the other. If it's not affecting your fertility, it can affect your weight. If it's not affecting your weight, it can affect your skin. If it's not affecting your skin, it can affect any part of your body, such as your eye, your vision. Food we eat can affect our vision. Yes. So we need to be very careful. When you see any couple facing this challenge of this infertility, don't think it is woman thing. All this can cause infertility. Low sperm count, abnormal sperm movement, or shape can cause infertility in male. And once you're having that problem, there's no way you can release a good sperm into your woman. And once that happens, there's no way your woman can conceive. So stop saying that the problem in the house, the problem of infertility lies on women alone. You check yourself, men. Check yourself. It is time we take the responsibility together and see that this problem is our problem. It's not her problem. Yes, let's take that responsibility. Because when it comes to head of the family, we want to say, I am the head of the family. But when it comes to problem of infertility, you are not. No, the problem may be coming from you. So ladies, take note of this. When there is a problem in the house, you guys face it together. Check each other. Both of you should go for evaluation and see where the problem is. And when you have a man that smoke and drink, oh Lord, you will definitely have problem. If you don't take action now, action will take you in the future. That's all I'm going to say when it comes to male factor in infertility. Next is stress. I've mentioned stress. Yes, stress can also negatively impact fertility. Of course, you feel anxious when you are trying to conceive. This is normal. Yes, when it's 1 month, 2 months, 3 months, you started getting worried. You started getting agitated. Oh, why am I not getting pregnant? Is it what I've done in the past? Thank God you even think about that. Is it my mother? Is it my brother? Is it my stepmother? Especially those that come from polygamous house. Oh Lord. Oh, it's my stepmother. It is this, is that. Oh Lord. We get worried. Yes. All these can cause stress on us. Especially when you know and you later realize that all these reasons are not the reason why you cannot conceive. You feel so bad. And meanwhile, you've already put yourself in a bad mood, which is so stressful for your body. All this, of course, I said it again, they are normal to go through this and that. It is normal. It is definitely normal to be stressful. But whether or not that impact fertility is up for the debate. Yes. What I want you to know is that managing stress is good for you. You need to adopt that system, that method, that habit. You need to adopt it and manage stress. Whatever comes your way, whether it's taking too long, whether it's taking too short, 3 months, 6 months, 1 year, 2 years, you need to be patient. You need to trust in God. You need to pray. You need to eat good. You need to live a healthy lifestyle. Do your part. Check yourself out medically, naturally, mentally, physically, emotionally. You need to check yourself. Make sure everything is balanced. Once everything is balanced on your part, leave the rest to God to take care of. You don't have to stress yourself out. Yes, I said it earlier. It is only in Nigeria you get worked up, you get worried for not having babies on time or at all. If you marry an American, you don't need to worry. It doesn't come. Pregnancy, they can't kill you like Nigerian. Nigerian will not take knife to cut your head, but they will kill you with their mouth, with their action, with their attitude of not getting pregnant on time. They will kill you right there. That can be a stress, I understand. But here, love, support. That is what they need. Know the baby. If baby comes 5, it doesn't come, they are adults. There are lots of ways you can get pregnant. Please, my dear sister, don't get yourself worried. Don't kill yourself because you have not gotten one. Yes. And let me tell you this. I know this is what I'm going to say. It's going to throw somebody off. It's going to piss somebody off. It's going to irritate somebody. It's going to aggravate somebody. You know what? I don't care. You know why I don't care? I don't care because I want people to live in peace, in harmony, in love, in stressless life. If you are married and wait and wait and wait and wait, no pregnancy, you cannot conceive. There are a lot of ways you can get pregnant. Yes, there are a lot of ways. I'm going to mention it shortly. When I get there, just pay attention to what I'm saying, then follow. Come along with me. So don't worry yourself. I'm telling you, age is next. Age is also a big major factor for women when trying to get pregnant. Yes. When you hear this phrase, your biological clock is ticking, that refers to your fertile window. And this basically means that it takes the mercy of God for a woman to conceive after a menstrual cycle has stopped. Usually, sometimes in your 40s and 50s, once your biological clock ticked, that's it. That means you have entered menopause and nothing can be done except if the menopause is medically reversed. I read that they can reverse menopause. I've never seen it too. I've just added it. Maybe I'll research to know if you can medically reverse menopause. I had it. But I'm going to talk about it more when I do my research and realize that this is medically proven that this can happen. Then I'll bring you back the information. Of course, all adults should know that men produce sperm throughout their lifetime. That is why you see Baba 80, Baba 100 having a child. Yes. Baba 80 impregnate 20 years old girl. Because Baba. Because Baba can still produce sperm. That is why. But women are born with a set number of eggs that decreases as you age. So don't be tricked by your age into thinking you are looking younger when you are aging. If you know that your age is not on your side, if you see a serious man, if you are the type that really want to have a baby, when you see a man that is serious, have your baby. Now, how do you know it is a medical reason that has been preventing you from getting pregnant all this while? How do you know that? Because many people think that once they wait 1 month, 2 months, 3 months for going to 6 to 1 year, they begin to attach it to things that have nothing to do with them. And meanwhile, there is a problem, medical condition in them. They need to assess why they not doing so. You need to go for multi-part assessments, which includes, number 1, physical examination. You need to do periodic physical examination. You need to see your OBGYN, gynecologist. You need to see your gynecologist every year. You need to do your pap smear. You need to do your mammogram. You need to check your pelvic. You need to check your uterus. You need to check your vagina. Everything needs to be checked yearly. And once you are expecting baby, meaning that you want to get pregnant, you can't wait for 1 year. You cannot do your physical examination once a year. You have to do it every 6 months. Your case is different from us that are not looking for a child. You are looking for a child. You want to get pregnant. You can't do yours once a year. It has to be every 3, 6, or 1 every year. It has to be every 3 months. If you have waited over a year, it has to be every 3 months or 6 months. Physical examination. You also want to do pelvic ultrasound. Once you see your gynecologist, it will definitely check your pelvic. And this is done on ultrasound, the machine called ultrasound. You also want to check your blood. You do blood work. Sometimes our blood needs to be tested. We need to check how the blood in our body is running, is functioning. It is very important. Blood work will determine all the vitamins in your body, all the minerals in your body, whether you need more minerals, you need more vitamins. They will tell you. Blood work will determine that. Whether your red blood cell is low or is not clean, is this or white blood, everything will be done through blood work. Men also need to do semen analysis. If you are having problem in your marriage, you know that your wife is not conceiving on time, you also need to do semen analysis. Maybe they will find out that your drinking or your smoking habit is the cause if you do this test. And lastly, you want to evaluate the uterus and fallopian tubes. This is very important. Evaluation of uterus and fallopian tubes is very important. And this is done by specialized x-rays or ultrasounds again. If you can do all this, if you or your spouse can do all this, I don't think there should be any problem. Yes. And if you or your spouse have a non-medical condition that affects the uterus, fallopian tubes, sperm, or ovulation, what do? You need to talk to an infertility specialist to get evaluated as soon as possible for the best infertility treatment. Sometimes we see the wrong specialist. It's only in Africa. One doctor specializes on every condition. Yes. One doctor will take care of the eyes, your nose, your mouth, your head, your women, feminine, men, everything. One doctor will take care of. Who does that? You need to see a right specialist for that particular problem. If you are having problem with infertility, you need to see an infertility specialist. Gynecologists. These are the people that take care of this problem, not a eye doctor, not a surgeon, not oncologist. All these have nothing to do with your infertility. Yes. You need to see infertility specialists and get evaluated as soon as possible for the best treatment option, such as ovulation medications, if you need one, intrauterine insemination, IUI, in vitro fertilization. All this can be done. Some of these I mentioned can be done if you are not in your menopause. Yes, once you reach your menopause, these are impossible. All these are impossible for you. Yes. So every couple deserves a child. So to say, in Africa, I would say, it is not a must in other country. But if we cherish a child so much, we have to respect that. We have to respect that culture. We have to respect that, tradition. So to me, every human beings, adults who at that age, at the age to have a child, deserves a child. So be rest assured that your child is here if you believe and do what is necessary. That is my belief, and that is my advice. And you need to stop being worried. Instead of being worried, just take it to God in prayer and in action. Sometimes we pray, we don't put it into action. That is the problem we have. And that is why many prayers are not being answered. When we pray, we don't put into action what we prayed for. You can't do that. Please, let me stop here and come back next week, Sunday, to bring you more information on health and nutrition. I'm Dr. Betty. I want to say thank you so much for joining us today. Remain blessed and have a good, productive week. Good night.